Good morning, it's 6 a.m. Welcome to the morning news on 3FM 92.7. We're streaming on all our social media platforms at 3FM 92.7. I am Christabel Success Trevor. Coming up this morning, Attorney General formally probes payment of $3.4 million made under a $13 million contract for the planned Cybersecurity Authority headquarters. Also this morning, one person confirmed dead while a chief and 6 others are receiving treatment following a shooting incident involving suspected illegal miners in the Western North region. Plus, Ghana activates precautionary measures against possible Ebola virus spread as at least 100 deaths reported in outbreak in the Democratic Republic of Congo. We've got all the details for you. Please stay with us. And now the details. Samuel Nartey George, the Minister for Communication, Digital Technology and Innovation, has indicated that the Attorney General has been formally asked to probe a payment of $3.4 million made under a $13 million contract for the planned Cybersecurity Authority headquarters. According to him, the project has so far seen only foundational works completed, despite the substantial disbursement already made. He added that the contractors involved, Raison Group Limited and Mendana and Sauza, who are now requesting an additional $4 million, even though the current work is limited to the foundation stage. The minister further disclosed that about $10 million has also been spent on cybersecurity meant for the authority, but the system has yet to be supplied. Speaking after his appearance before the Public Accounts Committee, he stressed that any individuals found responsible for possible financial misconduct should face the appropriate sanctions.
So it was both the building and then some software. The software is about another $50 million thereabout, and we had paid in excess of $10 million, $10.9 million thereabout, and that was for a baseline study. No development whatsoever had started, and for me, I thought that we could not continue along that path. There was a need for it. There's a need for it to be investigated. I'm happy it got flagged in the Minister for Finance's special audit. We went before that committee and told the finance minister that we're not interested in it and we thought that it should be investigated. I'm happy Public Accounts has picked it up. Now I'm hoping that the Attorney General will conduct an investigation into the matter, and if the investigation shows that the monies that have been paid, we got value for it, so be it. If the investigation show that people have been paid in excess of what they should have been paid, there has to be recoveries to the state because, like I said before the committee, the Public Financial Management Act is clear. You pay 15% maximum as mobilization. The advanced mobilizations that were paid were 30%. I mean, I don't understand why anybody would do that.
Samuel Nartey George is the Minister for Communication, Digital Technology and Innovation. One person has been confirmed dead while a chief and 6 others are receiving treatment following a shooting incident involving suspected illegal miners at Asawinso A of the Western North region. The incident reportedly occurred when the chief, Nana Kwesi Eyim II, together with some youth from the community, visited the Afao Hill Forest Reserve, where illegal mining activities were said to be taking place. According to eyewitness accounts, the group had gone to the forest enclave to assess the activities of illegal miners operating in the area and the extent of destruction caused to the forest reserve. An eyewitness, Kwame Wudu, said the chief engaged the miners in a peaceful discussion and appealed to them to stop the illegal mining activities. However, while the group was returning from the site, they were allegedly ambushed by heavily built men believed to be connected to the illegal miners. The attackers reportedly opened fire on the group, leaving several people seriously injured. Away from that, President Mahama has called for a major overhaul of the global health financing system, warning that Africa can no longer depend on what he described as an outdated model of donor dependency. Addressing delegates in Geneva, he maintains that too many communiques from such international meetings without actions is a detriment to global health success. There's more in this report.
Among the many world leaders across the world, the focus was Ghana's success in health despite the myriad of challenges that has bedeviled it in its implementation. The World Health Organization's highest decision-making body, the annual gathering, brings together global delegates to set strategic health priorities, approve operational budgets, and address pressing public health emergencies. President Mahama walked into the Palais des Nations in the serene Swiss city, Geneva, the world charting a new path, focusing on moving on to a new challenge of fending for its own with the withdrawal of finances. Switzerland, having hosted the WHO over decades, says it has a strong belief in the Global Health Organization, with a pledge of 269 million Swiss francs for recapitalization. The president mounted the rostrum clear in his mind, telling the Ghanaian story.
And by sovereignty, we do not mean isolationism. We're advocating the practical capacity of a nation to finance its own core functions, regulate its own quality, produce its own medicines, and govern its own data. Ministers of health in the Global South often spend more time writing donor reports than designing and fixing primary health care. This is a system that has confused the multiplication of institutions with the multiplication of impact.
The Assembly, having been hit with the reality, is re-looking inward at radical reforms that will give sovereignty to member countries, but the President sounded the caution.
Let us not let reform be a ceiling. If we are to fix the system, we must be brave enough to look at institutional mandates and measures without fears.
Now, the Ebola outbreak in DR Congo continues to raise concern across Africa after the World Health Organization declared the situation a public health emergency of international concern. With at least 100 deaths and 246 suspected cases already recorded, countries are being urged to strengthen surveillance and preparedness measures to prevent any further spread of the virus. In Ghana, health authorities say there are no confirmed cases, but precautionary systems are already being activated nationwide. Safwa Boahene has the rest of the story.
In Ghana, authorities say response systems are already being reviewed and strengthened. The Ghana Health Service says the country also has the capacity to test suspected samples if necessary. Dr. Franklin Esiedu-Bekwin is the Director of Public Health, Ghana Health Service.
What we are doing as a country is that we already have our Ebola virus disease response plan. So this plan is going to be updated. And then one of the things we're going to look at the very thematic areas. So the idea is that you have the capacity to detect the cases. And clearly you have several people. So we're going to kind of orient our several people to make sure that they can actually suspect the cases and detect.
The Ghana Health Service is urging the public to remain cautious and avoid practices that could expose them to infection.
The reason why it was declared as a public health emergency of international concern is the rapidity of the spread. You understand? So the idea is that you shouldn't take anything for granted. Ghanaians should be on the lookout. Make sure that you wash your hands, so that you don't get into contact with somebody who is ill. And those are the things that we're going to make sure that you broadcast enough information to the Ghanaians to be aware of the situation.
For now, Ghana remains without a confirmed Ebola case.
The Ghana Unemployed Nurses and Midwives Association is raising concerns over the Ministry of Health's latest recruitment exercise. The association is accusing authorities of leaving out many qualified professionals despite years of waiting for employment. But the Ministry of Health has defended the recruitment process. Members of the association say the prolonged delays in recruitment continue to affect their livelihoods and mental well-being.
We feel it should have been open to all of us so that we can just go in, and out of the 100 people, we'll all get the slots and then go and work. Now that they said we should take the lead, and then they will open again for another group from the same class, from the same year group, to come and join us later. And nursing is hierarchical.
There is a need that the government boost all 2021 year group.
We are very disturbed, we feel dejected, because our situation is very bad.
The group is also questioning why some professionals were recruited.
However, the Ministry of Health has defended this process. Frederick Mensah is the Director of Human Resources at the Ministry of Health.
These objectives, guided by the human resource policies and operational documents of the Ministry and its agencies, such as Ghana Health Service, CHAG, Ahmadiyya Health Services, and Mental Health Authority, were used to determine the allocations by professions and by locations.
That was the Director of Human Resources at the Ministry of Health, Frederick Mensah Ichampong, ending the 6 a.m. news on 3FM 92.7. Please log on to our website for more details. That's www.3news.com. I am Christabel Success Trevor. Business News is up next.